Greetings, everyone. I'm Nalini from Sri Lanka. I'm starting a short video series where I will be hosting some of my colleagues who have done some really interesting master's research studies. So today I have the privilege of getting to talk to Dr. Naif from Baghdad, Iraq. Dr. Naif is a fellow Chevening scholar. And so, yeah, I'm not going to talk much. I'm giving the mic over to Dr. Naif. If you could please introduce yourself.
Well, hi Nalini and hi everyone. I'm glad to be here. I'm Nayyef. I'm from Iraq and I'm a medical doctor. I've been practicing medicine in Baghdad public health hospitals and working in psychology because my master was about social and applied psychology besides practicing medicine. So I'm happy to talk about my study, about my findings.
Great, I'm so excited. So if you could tell us what your study was and also why you chose that topic.
I was motivated to study about the experiences of my fellow medical doctors working in the public system in Iraq. So as I was studying psychology, I wanted to study the psychology and the experiences of medical doctors in these hospitals. So I try to focus on the stress and anxiety that young doctors especially go through in their work at the public hospitals, and how might that be related to having thoughts about quitting or about even showing displaced aggression.
Okay, so we're talking about the psychology of doctors in the health system of Iraq, and you are trying to understand their displaced aggression and also the motivation to quit. But now, before getting to the specifics of your research, if you could give us a small context of the health system in Iraq. We know that Iraq has been through a lot. Even Sri Lanka has been through a lot. But then, that's kind of why I'm really interested in your study as well, because it relates to Sri Lanka in a way. But if you could just describe what the experience of Iraq was, especially the health system, and has the health system been adapting well, and what is it like today?
Okay, well, Iraq, it used to be like during the 70s, and this is I did not experience myself, but this is what I hear in the news and some of the resources, that Iraq was like a place where medical tourism would go to from the neighboring countries because it was pioneering at that time in medical and health services. But what happened, like, it's also known about the conflicts of Iraq, that from the Iranian war for 8 years until the 90s, with the Gulf War, and then with the economic sanctions, which drained the resources and services in Iraq, until the 2003 war, and then the civil war in 2005 and 2006, and then the war against ISIS in 2014, which ended in 2017. Of course, it's drained the medical and health services in the country. These conflicts have put a lot of burden on the hospitals itself, the staff working there, and also not only because of lack of enough resources, but also by the burden of increased population. Because like the hospital I used to work when I first graduated, it was built during the 70s. And these, what we call teaching hospitals, they are about the same in number when the time they were built in the 70s and 80s till now, in which the population is almost double now. We have about more than 40 million, the Iraqi population. And these health services are now built for a population of maybe less than 20 million. So this increases burden and pressure on the staff, that they are treating more people, they are seeing more patients. And the conflicts on the other side, it made the same hospitals that to also serve military. Like the time before 2003, there was some specialized military hospitals. But what happened afterwards is that we have only field hospitals who would be the first responder, and then they would be transferred to secondary and tertiary hospitals in which we treat both civilians and military, and this also another stress and burden on the working staff. I have experienced myself few times of like highly dangerous, I would say, work environment or elevated stress because of that, because the number of patients we deal with, the type of patients we deal with. And I saw that this kind of stress and anxiety is somehow missed, like the implications even of this stress and anxiety on the Iraqi doctors. So I wanted to focus and make some kind, I would say, some proper or systematic research focusing on the health system, or more specifically, the experiences of the Iraqi doctors. And that's why I chose this topic. I might need to explain some of these terms. Well, it's clear about what's the meaning of stress and anxiety, but motivation to quit, or as we call it, turnover intentions, it's about the thought of a person to voluntarily decide that he wants to quit his job. And of course, that might be related to a lot of factors. So I was trying to measure how these thoughts about quitting are related to the stress and anxiety. And my other outcome I was trying to measure is what we call displaced aggression. And by displaced, it means by targeting or showing aggression at someone other than the source of the stress or anxiety. So to give you an example, like you have a day at work and your supervisor would be shouting at you for something you did or you did not did. And what happens is that you cannot retaliate directly and shout back at your supervisor, because you might be thinking, is it worth to lose my job? But what happens is that you keep thinking about this incident, and it stays with your mind, and you still in this stressed state, I would say. And this process, what we call rumination, which was also part of my study. And maybe you will go back to your home and you will find that food is not ready yet, and you start shouting. It's not because of the food directly, because it's like a minimal thing, but it's because you've been thinking and experiencing the first incident of your supervisor shouting at you. So you direct it at someone else, like one of your family or friends who did not really provoke you in the first place. And that is what's called displaced aggression.
Awesome. So you kind of described your research question as well. So when you said you are going to compare anxiety and stress with motivation to quit and displaced aggression. So what was the methodology that you used?
Okay, I wanted first to see what the literature has about Iraqi doctors first. And it was challenging because it was hard to find enough resources talking about that. Like I would find some small papers or some articles talking about the experiences of doctors in Iraq. And that was also a challenge. But my methodology, I used validated scales, and I built a questionnaire. Some of them are open to everyone, and some of the scales I needed to take the permission of the authors to use, and thankfully to them that they allowed me to use to measure perceived stress, job anxiety, life satisfaction, and as I mentioned, the motivation to quit, as well as displaced aggression. And the study was cross-sectional, using, so I would say it's a correlational study. And I measured predictors and outcomes. And for more specific methodology, I used regression to see how these predictors, the stress and anxiety, might be a predictor of increased tendency to quit or to show displaced aggression. And how might these relationships could be explained partly by rumination. And rumination is the process I mentioned, that about having intrusive thoughts about some negative experience, like when I mentioned your supervisor shouting at you and you keep thinking about it all day. So it's like your mind is still engaged with that incident, and how might that affect your life.
Oh, wow. So, and what about your sample size? Did you mention? I don't think you mentioned, but this is one of my favorite parts of your research.
It is also one of my favorite parts because it was like surprising to me. Well, the thing is, my data collection was during just about the time of the pandemic when it was started in 2020. So I started collecting sample in March, and I was actually concerned, and I discussed that with my supervisor about how many doctors would be really interested or have the time to fill in some 15 to 20 minutes survey about their work. They might just like get bored with it and leave it. And I might not have a good sample size to find results about my hypothesis and trying to answer my question. And I was very surprised is that hundreds were filling the survey. Well, the source of my data was there's a specific medical groups on the social media, including Facebook, only for doctors, and they only let doctors to be in these groups. They do some kind of simple validation by asking about ID or something, or like work place ID to prove that you are a doctor, and so they let you in these groups. And these groups have thousands of doctors from all over Iraq. They discuss a lot about their work experiences, and it's a way to connect. And maybe that's a way they can also cope with the stress when they are in such network. So I shared my questionnaire in these groups, and I was surprised that hundreds were filling the survey in just like a few weeks. So at the time I closed the survey, it was about 804 specifically who started the survey.
Yeah.
So we were like picky at this time, so we only collected the ones who completed the survey, and it was still a very large sample size. It was 500. It was more than 560 participants who completed the questionnaire, and it was a very good balance. It was 55% female and 45 who identified as males in the study. So it was balanced. Also, it was balanced between junior to consultant doctors. So I was very happy with this sample size. My supervisor was very happy too.
Yeah, of course. So what about the results? And this is the exciting part. What about the implications of what you found as well?
Well, the results, it's conflicting to talk about, because I can say that I'm happy because it supported my hypothesis, but also because it's some kind of a sad hypothesis. So it was like somehow it was supported with the results. So what I found is that unfortunately Iraqi doctors have high levels of work stress and job anxiety, and these were significant predictors of increased tendency to think about quitting and to show displaced aggression. Iraqi doctors, they also scored low on life satisfaction, which is unfortunate finding as well. The good thing is that despite the stress and anxiety, Iraqi doctors, they showed low levels of displaced aggression. So I would say Iraqi doctors, they don't go fight with innocent people just because they had like some tough days at work, but still stress and anxiety were significant predictors of displaced aggression. And when we dug deeper in the analysis, we tried to explain how these experiences of stress and anxiety can lead or predict turnover intentions, like the motivation to quit or the showing displaced aggression behavior. And we found that rumination, which was a mediator in our study, partly explained some of these relationships. That ruminating about the negative events or negative experiences at work, to some part, they explained the relationship, especially between work stress and the motivation to quit.
Okay.
And this make us give the question about how to tackle rumination and stress, because to be honest, I mean, work stress is part of working as a doctor. We cannot eliminate all sources of stress, but we would say like some of the stress that doctors should not be dealing with, like being targeted with physical violence, which happens in Iraq, or verbal violence. And this is like these are a great deal of stressors. It was unfortunate to read about one of the papers that showed about 50% of Iraqi doctors, they want to leave. And that is a huge percentage.
Where do they want?
They want to leave Iraq.
Oh, right. Right.
Yeah, and that was something sad to say and to read. But we would say like tackling some of the stressors might improve the overall work experience of doctors. Like I would say there isn't good support system at work to maybe help them with the stress and anxiety.
Okay.
And that might be something to think about if you want to keep the doctors working and improve their work experience. We need to think about these negative experiences.
Yeah. So just a question. So when you said motivation to leave, motivation to quit, is it to quit medicine or to quit that hospital?
No, it was to overall quit working in the public health system. So they might switch to just to private practice or to leave the country and practice somewhere else. So my study was focused about the experience in the public health system.
All right.
So in the state hospitals.
Okay. That's such an important.
Yeah, and I understand like even though not everyone, even though if they are quitting, if they are thinking about quitting, maybe for different reasons they don't do so. But that is still it's a negative predictor that they have low satisfaction with their jobs, and maybe if they get another chance or a different place to practice, they would leave. So even the tendency to think about quitting is an important thing to tackle to make these work environments better. If we want to improve the health system, we have to think about our patient, but at the same time, we think about the people working in the system. Exactly. So we would recommend to tackle rumination process related to work. And that could be by giving enough time of completely off work time, because we see like they give you sometimes work on weekends, maybe some workplaces, they send you email, you need to respond. So somehow they keep you engaged in work. And what we found that, what we suggest is that it's important to give some enough free time off work to just disconnect from the work, to restart and replenish your energy to deal with the stress in a more constructive and better way. So that's what so far we have suggested as part of the implications of our study.
Great. Thank
now
you.
I'm still working with my supervisor, and we're working on getting it published hopefully soon.
Oh, that's great. We can share it around as well. Thank you for your
Fingers
time.
crossed. Yeah.
Thank you for your time, Dr. Nayyef. Really appreciate it. So thank you everyone for watching. If you have any questions, Dr. Nayyef has agreed to actually be available for you to talk to. So you can just write to me. I've put an email address in the description below. So contact me and I will put you in touch with Dr. Nayyef. Thanks again, everybody. Thanks again, Dr. Nayyef. We'll catch you soon.
Thank you so much. I'm happy to be here.
Okay, bye-bye.